Do you want to prescribe medications someday? I certainly did, so I was very excited about it, and I still am excited about it, even though it comes up with a lot of responsibility. But I like to be able to help people. I feel quality of life is really important. So while I don't overprescribe, sometimes medications are needed. So as we went through the last chapter one, we talked about who can prescribe medications and how we can get to prescribe and how there's some limitations and it depends state by state. So now let's find out how we are going to prescribe. So what do we have to do? There's a couple things we need in order to prescribe. We need a DEA number and an NPI number. After you graduate from your program for nurse practitioner and you get a new job, your first job, you will be assigned a national provider number and a DEA number. The Drug Enforcement Agency DEA number, that's when you have to take a little online open book exam through the DEA and be able to pass that, and then you will get assigned your DEA number. You have to show obviously your license and things like that. You'll be able to prescribe the narcotics, schedules 2 through 5. And again, remember, it depends on the state, but Wisconsin, we can do that. Now, your NPI number is across the country. It's an identifier. It's a 10-digit number that you get. And it has to do with the Health Insurance Portability and Accountability Act, HIPAA. So you're given an NPI number, and that will stay with you all the time. So when I call in prescriptions, I give them my NPI number. Many of them have it on record already, but you give them the NPI. If you're prescribing a narcotic, you give them the DEA number, and it's used for billing also. So what are some responsibilities? A lot of responsibilities. So you have to know who you're prescribing it to. There's some ethical issues, like don't prescribe medications for family or friends or for yourself. And I recommend you start that out immediately. You just say you can't do it. It's against regulations, because once you get started on that, it can put you down a terrible path where people are texting you constantly. So it's an ethical thing. So it's recommended not to prescribe. In reality, is it done? Sometimes it is, yes, but it's not recommended, and it's saving you some stress. Also, you need to have documentation. So every single thing you prescribe needs a document, whether it is paper form or through an electronic health record. You have to have a plan on how that you went over side effects, drug monitoring, how you're going to get them off the medication if needed. Also, what affects your drug selection? I would say that 90% of the time when I'm choosing a drug, I'm thinking of cost. I'm looking at their insurance, and I'm saying, okay, do you have a copay? What's your insurance? Because most drug classes have multiple ones to pick from, and some are cheaper than others, and a lot of them work really well that are older medications. Because if it's too much money, they're not going to get it. And if they do get it, they're not going to take it how they're supposed to. The other thing, guidelines. Guidelines are things that will be ingrained in your brain if you go on to become an advanced practice nurse. Everything we do is based on guidelines. This is done by research set by professional organizations that says, okay, for diabetes, I should prescribe metformin as first line. For hypertension, who's a diabetic, I should prescribe a beta blocker first time. Availability, this goes back to what's on the formulary and their insurance company. Are there interactions, side effects, allergies? So these are all pretty self-explanatory, but I always have to keep cost in mind in addition to using all of the others. Here's a prescription example, and now with the electronic health records, you don't see these as much, but I do help out private practice physicians, as well as I have my own telemedicine business, and I use paper prescriptions if needed. And so as you can see here, you need to put down the name, allergies, date of birth, your medication, the strength, the quantity, the directions. You need to write it out. Take one daily and spell out one. It's ONE, daily. There used to be acronyms, abbreviations, and you'll probably have seen that before. We're trying to get away from that, because sometimes it's hard to read. And then your signature, your NPI, DEA if needed, your license number, which rarely I put on there, but you can, and your contact and pager number. And these were all the parts that I just mentioned. So that is, and I actually will be posting an example. There's some types of prescriptions other than the written prescription. You can phone prescriptions in, except for Schedule 2, you can't. So anything such as Vicodin, morphine, oxycodone, like that, you cannot. They have to pick up a written prescription. You cannot call in Adderall. You cannot call in Vyvanse. Those are all prescriptions that need to be picked up and hand delivered. And they need to be refilled every 30 days. You can't just give refills on them. Written is another one we just talked about. And as it says down below, avoid abbreviations, write out the words. And there's e-prescribing, which is very common now. And then most medications require refills, but you should be careful on who you're giving refills to. If you're prescribing the first time, I don't give them refills because I want them to come back. And I want to monitor and I want to see if the medication is working for them. Maybe they need labs to monitor. Once people are stable on medications that are long-term, I will give 3 refills or 6 refills, sometimes up to a year. It just depends. And that is it.